I had planned to share with you some thoughts and impressions that I have had as a research integrity researcher for the last 3 to 4 years with a background in epidemiology, but also my experiences in pandemic science, speed science, and open science. This has been an extremely interesting 1.5 years for me, having been in 2 different fields that sort of came together: infectious disease epidemiology and research integrity. And I would be happy to get into a conversation with you. So I want to talk to you about a number of different themes today. Just trying to get my slides to move. There we go. So I want to share with you some impressions on science being done in a pandemic, which essentially has resulted in speeding up science. Open science, specifically, I want to zoom in and share some impressions relating to preprints. Research integrity, which is my current field of expertise, and the future of science with regards to the interplay of these themes. And I hope that some of these reflections will lead to a lively discussion with all of you. So just very quickly, as Lena mentioned, you may have remembered that this time last year, the National Survey on Research Integrity was launched. I guess everyone who is in the audience is a researcher, and you should have received an email invite. Hopefully it did not end up in your spam box. And I hope that you are one of the approximately 7,000 respondents we had. This is basically what I've been focusing for the last 3 to 4 years, namely in the design and analysis of what is currently one of the world's largest research integrity studies, and also one of the most comprehensive studies looking at a number of different research practices, questionable research practices, research misconduct, but also responsible research practices, and interestingly, the associative factors. And what has been interesting for me in the last year is that these 2 areas of my expertise in infectious disease epidemiology, specifically being involved in the SARS epidemic during my career with the Singapore government, and the interplay actually with the speed at which COVID science was evolving, sort of came together. And this led to a whole host of very nice opportunities for me to be able to discuss the impact and also reflect on the impact of speed science and research quality in a number of various forums, as well as to be involved in the COVID-19 policy debate in the Netherlands as part of the RED team. You may or may not have heard of the RED team, a multidisciplinary group of experts who were basically doing exactly as its name suggests, trying to provide constructive critique to the outbreak management team in the Netherlands, although we were not always viewed as that, unfortunately. But moving on. So what was striking for me as an epidemiologist involved in the control and prevention of the SARS epidemic some 17 years ago, which is essentially a world before open science and preprints, and even the extent of social media, was the sheer explosion of scientific papers being published. And what you see here are 2 graphs, one on the left and one on the right. They both have strikingly similar exponential growth, except the graph on the left is on COVID-19 cases since the global alert from the WHO. And the graph on the right is an explosion of COVID-19 publications, round about the same time. The bottom 2 lines that you see on the right graph are papers published compared to other recent outbreaks of novel coronaviruses, SARS and MERS in particular. And really what we see here is that there has been both an explosion of not only COVID-19 cases, but an equal explosion of publications on this topic like never before. And this speed has partly resulted in faster journal publications. So this figure is taken actually from a Nature article assessing actually how quickly publications were coming in journals. And what you see is that the time between peer review to publication dropped by half, but only for COVID-19 publications. It went from about 120 days to about 60 days. There was not much change for non-COVID-19 publications. But really where we saw the surge is in preprints, as shown again in this nice Nature analysis taken from around about mid-2020. The graph on the top is comparing COVID preprints in orange against non-COVID preprints in gray bars. And what we see is that the COVID preprints saw a surge of up to 500 articles per week. And that is quite an immense amount of volume of research being pushed out on preprints. Most of them were coming deposited actually in medRxiv, despite this being the most recent preprint server. It's been in existence only since 2013, compared to some of the older archives, which have been around for the last 30 years. And that also essentially reflects the type of research where we saw the bulk in surge. So what we see is not only research being conducted at unprecedented speed, but open science, and I want to focus today on preprints. There is an unprecedented surge in preprints as well in this COVID-19 pandemic. And this was something that we had not seen before in a health crisis. Another new phenomenon we witnessed in this pandemic is the amplification of research by social media, namely Twitter, blog posts, and so on. And it made me reflect on the question of if science being done in a crisis is leading to science in itself being in a crisis. So a bit of an interplay of words here. And so really these are the three themes that I would like to actually share some impressions with you. And the underlying basis of this is obviously how can we safeguard research integrity. So the early sharing of research findings can aggravate a crisis. And I say can because this is not always the case, clearly. But it can aggravate a crisis, especially if that research is flawed. And here you see some examples, some prominent examples. I think you must have all heard about some of these examples. The most prominent one being the hydroxychloroquine or the anti-malaria drug, based on a severely flawed study by the infamous author pictured here, Didier Raoult, which led to essentially many consequences relating to policy decisions that were taken. And one such policy decision that led to implications was a massive diversion of this drug supply from lupus patients for which it had a indication to COVID-19 patients. Another very famous example, and more recently, is the ivermectin saga, again based on a flawed preprint, which led to some serious drug overdoses and fatalities in patients in different parts of the world. Some other examples where we have seen an impact of flawed early research findings being shared fairly early in the process are biased models on transmission dynamics of the virus, fierce debates going on the effectiveness of the face masks, vaccine side effects, and so on. I do want to say that I am not, by making this statement, I'm not saying that journal publications are the holy grail. I think we all know that journal publications and peer reviews have had some historical retractions themselves. But what I am saying is that there can be detrimental effects when early research, early flawed research is shared in a crisis. So just to balance that picture, not all of this speed science has been detrimental. Quick sharing of research has also had some positive examples. And briefly, just to mention that to balance the picture out, is that quick sharing of research, especially around clinical observations, such as the finding of thrombosis playing an important role in disease development and treatment of COVID-19 patients, as well as airway management of COVID-19 patients. These were all early clinical observations that were shared, and they had a significant impact on improving the prognosis of patients. Other examples include the sharing of code for contact tracing applications, and so on. However, the point here is that there seems to be an important distinction needed between the types of early research, namely treatment and intervention types of research, serological research, model predictions, that may potentially be more harmful when they are not supported by methodologically rigorous studies. So we should make a differentiation here in terms of type of studies and early finding of these studies. So that brings me actually to the crux of the issue: are preprints helping or hurting research integrity? And this past year, I have really been quite busy thinking about this question, sharing some of my own impressions, and I'm eager to hear what you have to say on this as well. Clearly, the views are divided, and I can openly state my conflict of interest. I belong to the camp of open science, but I do have reservations, and these are some reservations I want to share with you. So we have two open science communities here, so I'm preaching to the choir here. I don't really have to tell you the case for open science. Increased transparency means that scientific claims can be independently verifiable. It allows for public ownership of science, especially when this research is publicly funded. And these two main arguments resonate with Robert Merton, American sociologist from 1942, and the scientific ethos that he defined. In the interest of time, I'm unfortunately not able to go through these scientific ethos. They are pretty neat. I would encourage you to look up Robert Merton. But I would like to leave it at that for the case for open science. Now, having said all of this, as I've just mentioned to you in my introduction, I have been busy in the last 3 years with the design and the implementation and analysis of one of the largest surveys on research integrity. And our recent findings have been cause for some concern. What you see here are some of the main findings. I don't have time to go into all of the findings, unfortunately. Maybe that will be for another time, but all of this data is available to you as two preprints. And I would encourage you to look up our National Survey of Research Integrity website. I can put it in the chat box afterwards. But we essentially had round about 7,000 academics across all disciplinary fields and academic ranks. And what you see here are the findings on how frequent or the prevalence of any frequent questionable research practice. 1 in 2 researchers essentially admitted to frequently committing QRPs, questionable research practices. And then we asked how many individuals in the last 3 years had fabricated or falsified their data. And the last row, you see NEFF, that means having fabricated or falsified or done both in the last 3 years. And that was at about 8%, so 1 in 12. And these numbers, you may say, well, this is pertaining to the Dutch population. So how is that internationally? Well, they are in line with systematic review and meta-analysis that was recently done of research integrity surveys. So we are sort of like, these are the numbers that we are seeing, not specifically only to the Netherlands, but also more broadly. So in other words, the picture for research integrity is not looking really that rosy, which has made me wonder if sharing of early research findings might just be transferring this problem to the public domain. And I think this is a conversation that we are not having enough of in our open science communities. So so while I am a proponent for open science, I am also disturbed by the extent of questionable research practices. I am disturbed by unhealthy research cultures in which we function. And so I feel that along with the support and the push for open science practices, the rewarding and recognizing of open science practices, we must also simultaneously address the reasons behind questionable research practices, because that is pretty prevalent. Of course, we all know that peer review as it currently operates is not ideal, but that is also not my point. We know that research is a collaborative effort, and scholarly critique or organized skepticism, as Robert Merton called it, is essential in ensuring research quality. So where do we go from here? I have no idea how am I doing on time. Please unmute yourself and tell me, Lena, if I need to stop.
Five minutes, Gowri.
Okay, so where do we go from here for the future of science, open science, namely preprint sharing, and the extent of questionable research practices that we are seeing in our communities? A few reflections. I'm eager to engage in a dialogue with you. So I've listed a number of ways here. So the first is the critical feedback loop in open science is key. And what do I mean by that? Promoting scholarly critique of preprints, as much as recognizing and rewarding all forms of peer review is especially important as we start to promote and encourage open science practices. I think we need to also start encouraging the review of these preprints. And unfortunately, research shows us that the uptake of comments on preprints are quite low. This is quite different for COVID-19. We saw quite an extensive critique of COVID-19 preprints, but in general, this is not the case. Secondly, science communication is changing. The unofficial peer review playground has come to the open in terms of blog posts, Twitter posts, and what have you. And I think along with that, as we push for open science, we also need to push for open and responsible science communication. So how do we as researchers start interacting with different type of stakeholders more directly? Policymakers, the public, journalists, to name a few. It also means that scholarly critique is happening increasingly in the open on social media. And there will also be a need to protect against harassment, bullying, respectful dialogue as a skill is key. Sorry, I did not move slides. So moving on, science education and critical evaluation as tools to be thought broadly and early on in education. So research shows us that skills in critical evaluation and knowledge of the scientific process are good ways to counter mistrust in science for non-scientists. And I really think that this is key. So as we promote open science, we must also understand that this science is now open also to public access. And therefore, we also need to take the responsibility of ensuring that they have some basic skills in how to navigate and evaluate, at least more generally, the quality of this research. Fourth, preprint servers and their responsibilities towards research integrity. And there are some preprint servers have a two-tiered vetting process, but this is mostly superficial. So they are vetting against outrageous claims or conspiracy theories. I think there really needs to be a stepping up of and a discussion of what is the responsibility towards protecting research quality of preprint servers. Is it mainly a repository for us to put all sorts of research up there, or should there be some level of policies against fraudulent, sloppy preprints? So who is responsible for this? Moving on, critique for science at every stage and not just at the final stage. So there are a number of different initiatives that have come into play since then. Review Commons is one example, established since 2019. Where you can, as a researcher, request your work to be reviewed before it is posted as a preprint. Registered reports is, of course, another example where you are submitting the methodology of your research findings before you have conducted the research. Adopting a red team approach. This Nature article from Daniel Larkin sets out a very good case for researchers to actually hire their best critiques from the outset of your research and not only at the end in terms of peer review. Then there are some other specific examples relating to outbreak preprint review as well. So they are all steps in the positive direction, but I often feel that there's not enough attention and dialogue that is put in place within the open science discussion. And then to round off my last few slides, as I mentioned, I have been quite involved in actually sharing some thoughts along with some other research integrity colleagues. And so I just wanted to point out actually two other interesting pieces that I have shared my viewpoints on that you might wish to look. I'm happy to discuss these also offline. Including one a little bit less recently, this was last year, about assuring research integrity during a pandemic. I don't have time to go through that today, but I want to just leave you with this thought that as we move towards open science, not only is research becoming more accessible, But research integrity will increasingly be a collective responsibility of all stakeholders of research. And I think that this is an important dialogue for us to have, and to ensure that there are systems and mechanisms in place to safeguard the quality of research. I want to thank you, especially to Lena, for reaching out to me. Thank you to Joanne, and also actually to the NSRI team. And just a final word to say that we are having the World Conference on Research Integrity next year. It will be a hybrid event, hopefully one without many technical difficulties. So you are also welcome to look us up, and maybe we will see you online next year.